Chapter 5. Personal Safety and Emergency Care. Safety is a critical issue in all healthcare settings. Ensuring the safety of residents and protecting yourself as you provide care are your most important roles as a nurse assistant. Each year, billions of dollars in costs are associated with occupational injuries affecting workers in healthcare professions. These injuries can be prevented by staying alert and following guidelines for working safely with those in your care. The key to injury prevention is to use common sense and the right equipment for your assigned tasks. Learning how to prevent workplace injuries improves the quality of your work. But before beginning any task, ask yourself, am I at risk for exposure to any body fluids? Is there a better way to do this? What equipment or help do I need to complete the task safely? In this chapter, we discuss personal safety for you and the residents, how to protect yourself from bloodborne pathogens, and how to handle emergency situations and disasters. You will learn about ergonomics, injury prevention practices, and your role in facility safety programs. You will be introduced to potential hazards and learn how to be prepared for common emergency situations. Protecting yourself from bloodborne infections. Microorganisms in blood that are capable of causing disease are called bloodborne pathogens. Those of a major concern in healthcare settings include two types of the hepatitis virus, hepatitis B and hepatitis C, and the human immunodeficiency virus, HIV, which causes AIDS. Hepatitis B and C. Hepatitis is a disease characterized by inflammation of the liver. The hepatitis B virus, HBV, is present in high concentrations in the blood of an infected person. This means there is a greater chance of infection from HBV exposure than there is with exposure to HIV. Hepatitis B is one of the most common infectious diseases worldwide, but there is a vaccine to prevent it. Medications are currently available to treat HBV, but there is no cure. Some people infected with the HBV virus experience no symptoms and do not realize that they carry the virus in their blood. Symptoms include fever, weakness and fatigue, abdominal and/or joint pain, loss of appetite, nausea and/or vomiting, dark urine, and jaundice, yellowing of the skin and whites of the eyes. HBV is transmitted via contact with infected blood, through sexual contact with a person, and can be passed from a mother to infant during birth. Hepatitis C, HCV, can also be a silent disease with symptoms that emerge only after years or decades of infection. Symptoms are similar to HBV and may also include bruising and bleeding easily and swelling of the abdomen and/or legs. HCV is transmitted the same way as HBV. Chronic HCV is now curable with medications taken for 2 to 6 months. The most serious problem with HBV and HCV infections is that some people with these infections will never get well. Their liver damage may be so serious that they eventually need a liver transplant. HIV, AIDS. The human immunodeficiency virus, HIV, attacks the immune system and, if untreated, can lead to acquired immunodeficiency syndrome, AIDS, a potentially fatal condition. HIV is in other body fluids via sexual contact, contact with infected blood, by sharing needles, or from mother to child during pregnancy or breastfeeding. There is no cure for HIV/AIDS, but medications can slow its progression. Symptoms vary and may include fever, headache, sore throat, muscle and joint pain, rash, and swollen lymph glands. HIV infection can be detected with an antibody screening test, but often signs and symptoms do not occur for 10 or more years. During this time, an infected person can spread the infection to others. OSHA Bloodborne Pathogens Standard. In Chapter 4, you learned about standard precautions that must be used to prevent the transmission of infection. The Occupational Safety and Health Administration, OSHA, Bloodborne Pathogen Standard requires all healthcare agencies, including long-term care facilities, to follow the CDC standard precautions for bloodborne pathogens. The standards protects workers from all known and unknown diseases transmitted by blood. In addition, there are several other requirements which are described in the following sections. Preventing needle sticks. Microorganisms in blood can enter another person's body through an accidental needle stick. In this case, the needle is an intermediate object that transfers the resident's blood to you through your skin. OSHA requires that safety needles and syringes with attached safety devices be used. After using the needle, it is pressed against a hard surface and the needle retracts to a safe position out of the way. If a needle stick occurs, you must follow the facility policy for evaluation and follow-up. Diabetic residents may sometimes be allowed to self-inject their insulin, so being aware of your facility's policy is important in helping residents and ensuring proper disposal of needles and other supplies. Exposure Control Plan. OSHA requires that all facilities have a written exposure control plan to eliminate or minimize employees' exposure to blood and body fluids. Every department is covered by this plan, and every employee should be aware of the plan and be able to review it at any time. Engineering and practice controls. Engineering controls use various devices to reduce hazards. For example, a needle disposal container, sharps container, should be located near places where needles, blades, and other sharp items are used. By doing so, sharps can be disposed of directly without the need to transport them to another location. Personal protective equipment. OSHA mandates the use of personal protective equipment, discussed in detail in Chapter 4, which provides barriers that prevent contact between infectious microorganisms and a susceptible host. Gloves, masks, eye protection, and gowns or aprons protect you from contact with blood or other body fluids. Housekeeping. The facility environment must be kept clean and sanitary. OSHA requires a written cleaning schedule for each facility. This includes the methods for decontaminating surfaces or equipment soiled with blood or body fluids. If you have questions about how the OSHA bloodborne pathogen standard is implemented in your facility, ask the infection control practitioner. Hepatitis B vaccination and follow-up. OSHA requires that all facilities provide the hepatitis B vaccine free of charge to all employees who may have occupational exposure to blood or other infectious materials. OSHA also requires that facilities offer a free blood test 1 to 2 months after employees have received the last shot in the HBV vaccine series. This determines if the vaccine will be effective. The facilities cannot require that the employees receive the vaccine or blood test. If exposure occurs, they must provide immediate post-exposure evaluation and follow-up, either on-site or at another healthcare facility. The LTC facility covers the cost of any outside services. Information and training. The OSHA bloodborne pathogen standards requires that facilities provide information and training to all employees during working hours. This training must include information about bloodborne pathogens, tasks that involve occupational exposure, and ways to reduce the risk of exposure. Nurse assistant tasks involving exposure to blood. Because you provide the most resident care, you may notice blood in a resident's stool or vomit or in drainage from a wound. Always wear gloves when handling any resident's body secretions and excretions. The risk of being splashed in the eyes, nose, or mouth with any fluid containing blood can be minimized by following standard precaution procedures. If you are at risk of being splashed with any body fluids, even just a little, always wear the appropriate eye, nose, and mouth barrier protection. You may sometimes clean up spills on the floor in a resident's bathroom, which may include blood or other body fluids. Follow the facility's procedure for cleaning up spills using the correct detergent and disinfectant. Wear a gown, plastic apron if your skin or clothing may be soiled. Always wear gloves when cleaning any type of spill. The infection control practitioner or head housekeeper can teach you the best way to clean up spills. Sharp safety equipment. Nurse assistants do not usually perform tasks using needles or other sharps, but may be tasked with changing sharps disposal containers. Injury and exposure to infection can occur if needles are improperly disposed of, are sticking out of the top of the container, or have punctured the side of the container. To prevent injury, examine the sharps disposal container carefully before you touch it. Punctures from needles and other sharps and cuts with scalpels put healthcare workers at risk for many infections. All facilities have procedures for injury prevention. Studies have shown that on-the-job injuries can result from repetitive body movements, incorrect posture, lifting residents or items that are too heavy, using the wrong equipment, and using equipment incorrectly. When caring for a resident, injuries can be prevented by using a 5-step approach. 1. Determine the resident's capabilities. 2. Determine the equipment you need. 3. Determine and communicate to other staff the steps needed for safe handling. 4. Follow the care plan. 5. Evaluate the success of tasks performed. Ergonomics. Ergonomics is the scientific study of how people can function safely and efficiently at work. Its principles are the basis for policies, equipment, and staff training needed to provide quality care. You are not responsible for implementing these steps alone. The interdisciplinary team helps to determine the right steps for you and the resident. You may encounter situations where you must lift or help someone, but the physical demands are beyond your capability. If you rely on proven ergonomic principles, consider your capabilities and those of the resident, and use the appropriate equipment, you will make the task easier and safer for both of you. You must make sure that you know how to use all equipment before you begin the task. Repetitive motions such as bending, lifting, turning, and reaching put you at risk of injury. A resident's unpredictable actions also increase the risk. If you don't use the right equipment correctly or you misuse your body when performing your duties, you can seriously injure yourself and the resident. If you are unsure about how to move a resident safely or how to use a particular piece of equipment, ask the charge nurse for help. Injuries result from not knowing how to do something safely and from bad habits on the job. Sooner or later, if you are not careful, an injury will happen. As you begin your job as a nurse assistant, you have the perfect opportunity to develop safe work habits. Using practices based on ergonomic principles reduces your risk of being injured now and throughout your career. Being aware prevents injuries. Safety-related decision-making begins with your participation as part of the interdisciplinary team in assessing a resident's capabilities. Categorizing residents' abilities provides information that guides you in knowing the best way to move, transfer, or reposition them. It also helps in determining how to help with their daily care. As part of your orientation and training, you will learn your facility's system for communicating this information. This communication must not violate residents' right to privacy, but should give the staff information they need to work safely with the resident. Using the right equipment for each resident is an important part of preventing injuries. Many kinds of equipment can help you move residents from bed to chair, chair to toilet, and chair to bed. Other equipment is used to help position and reposition residents in their beds and chairs. The key is to know what is available and to follow the manufacturer's directions for its use. Table 5-1 provides examples of equipment that is commonly used to help move, transfer, or reposition residents and help with activities of daily living. Never put yourself or the resident at risk. Being safety conscious requires being observant, paying attention to details, and continually evaluating the situation. You must be willing to ask questions and to change your way of doing things if necessary. Ask the charge nurse about any procedure or equipment you do not completely understand. Ask the charge nurse for help in evaluating situations until you gain more experience. Remember, each resident and situation is different, so you must adapt your actions to meet the resident's unique needs. Rules for safety. Following are common sense rules that promote safety for you and your residents. These rules are grouped by how they affect residents, you, and the environment. Some rules involve all three. Consider each resident's individual safety needs. The needs of residents with visual impairments are different from those with hearing impairments. The key is to know your residents and their special needs, the equipment you can use, and other staff who can help. With this knowledge, you can adjust the rules to fit each situation. Residents. Before walking with a resident, check their path for potential trip hazards such as a bed crank. Encourage residents to use handrails and grip rails. When bathing residents, test the water temperature carefully to be sure it is not too hot or too cold. Residents' right to privacy, but should give the staff information they need to work safely with the resident. Using the right equipment for each resident is an important part of preventing injuries. Many kinds of equipment can help you move residents from bed to chair, chair to toilet, and chair to bed. Other equipment is used to help position and reposition residents in their beds and chairs. The key is to know what is available and to follow the manufacturer's directions for its use. Table 5-1 provides examples of equipment that is commonly used to help move, transfer, or reposition residents and help with activities of daily living. Never put yourself or the resident at risk. Being safety conscious requires being observant, paying attention to details, and continually evaluating the situation. You must be willing to ask questions and to change your way of doing things if necessary. Ask the charge nurse about any procedure or equipment you do not completely understand. Ask the charge nurse for help in evaluating situations until you gain more experience. Remember, each resident and situation is different, so you must adapt your actions to meet the resident's unique needs. Rules for safety. Following are common sense rules that promote safety for you and your residents. These rules are grouped by how they affect residents, you, and the environment. Some rules involve all three. Consider each resident's individual safety needs. The needs of residents with visual impairments are different from those with hearing impairments. The key is to know your residents and their special needs, the equipment you can use, and other staff who can help. With this knowledge, you can adjust the rules to fit each situation. Residents. Before walking with a resident, check their path for potential trip hazards such as a bed crank. Encourage residents to use handrails and grip rails. When bathing residents, test the water temperature carefully to be sure it is not too hot or too cold. Body mechanics. Body mechanics is the way in which the body balances and moves while engaged in daily activities. Proper body mechanics increase your efficiency and safety by using the body effectively while minimizing stress. With good body mechanics, the body does less work while carrying out a task. With poor body mechanics, the risk is increased for injuring your back or other body areas. Even though injuries such as strains and sprains may not seem serious, over time these minor injuries can lead to a more serious injury. Proper body mechanics ensure that every time you move, you are protecting yourself from injury. It is important to pay attention to protecting your back all day long. Before you lift a person or an object, take a moment to assess the situation. If you are about to lift a resident, first find out if they can help you. Use the appropriate equipment when needed. If you have any doubt about your ability to lift someone with or without equipment, get help before you attempt it. You will learn many different techniques for helping a resident move in bed and between bed and chair. You can injure your back if you are careless about body mechanics. Be aware of your posture and make sure you are moving and lifting the right way. Your body will thank you for it. You can think of the key principles of body mechanics 3 steps. 1. Assess the situation before beginning to lift, move, or position a resident. 2. Prepare yourself by considering your body mechanics. 3. Determine how to do the lift, move, or position. Preventing resident falls. Falls can cause serious injury at any age. When an elderly person falls, it can be extremely dangerous. Falls can result in cuts and bruises and serious injuries such as bone fractures and head injuries. Even if an injury does not occur or is relatively minor, a resident who's fallen may become fearful and less independent. They may stop walking by themselves or getting out of bed to use the bathroom. This loss of mobility can lead to a number of other problems. Maintaining the resident's independent mobility as long as possible is important for their health and quality of life. Falls occur for a number of reasons. As we age, our bodies change. Changes in the musculoskeletal and nervous systems, which affect posture and balance, make falls more likely. Many residents in long-term care are frail and have health conditions that affect their posture, balance, and mobility. Other factors that increase the chance of falling include poor vision, sensory problems, and the use of certain medications. Falls are more likely in residents with increased toileting needs and when residents' surroundings are cluttered and crowded. A fall can also occur if you are not moving correctly or using the correct equipment when moving, transferring, or walking with a resident. Environmental safety. The environment in a long-term care facility may present some safety hazards. The good news is that by being aware and taking proper action, you can avoid and control these hazards and prevent injuries. Wet floor and other safety hazards. Everyone is responsible for cleaning up spills. Regardless of whether you create a spill or see that one is already there, you must clean it up immediately. If you see a spill while responding to a medical emergency, you can call out to alert someone else that the spill must be cleaned up before anyone slips and is injured. You must be alert to anything on the floor that could cause a person to slip or trip, such as urine, water, broken floor tiles, soap, paper clips, bed cranks, food, and other items. Floor cleanup is simple. First, make sure that everyone is alerted to the danger by placing a wet floor sign in the area. Then use the appropriate supplies and equipment to wipe up the spill: paper towels, sponge, mop, etc. When working with water, as when helping a resident with bathing, showering, or washing hair, be extra careful. Falls are much more likely to occur when a resident is on a wet surface or water is being used. Keep your work area as clean and dry as possible. Electrical safety. Electrical safety is also everyone's concern. When working with or around electricity, follow these guidelines. Never use electrical devices near water. Always dry your hands before using electrical equipment. Never use extension cords or outlet expanders, devices with multiple that plug into a single outlet. Laws prohibit their use in facilities. If you're not currently using an electrical device, turn it off. Report any electrical shock from a device to your supervisor. The device should not be used again until it is repaired. Pay attention to electrical items brought in by residents and their family members. Items such as electric razors, televisions, radios, stereo CD players, fans, and lamps should be examined by maintenance staff to avoid potential electrical problems. Some facilities have a policy requiring an inspection before an electrical device can be used. Supervise any resident's use of equipment. Make sure that electrical devices are in working order. Frayed cords, missing safety guards, exposed wires, and cracks are signs of a problem. Sparks, excessive heat, or a hissing or buzzing sound are also signs that the device is not working properly. Do not use or allow a resident to use any device with these problems, and report any such conditions to your supervisor immediately. Chemical safety. By law, all employers and employees must know about any chemical hazards in the workplace and how to protect themselves from these hazards. Employers must communicate this information through employee training programs. The most common chemicals in long-term care facilities are disinfectants and cleaning products. If you follow the manufacturer's directions for their use, you and your residents will be safe. Your training will include understanding container labels. You must get in the habit of reading and following the label directions. Labels contain most of the information you need to protect you and your residents. If you find a container without a label, do not use it or smell it to guess what it is. Take it to the charge nurse immediately. If any hazardous chemicals are used in your facility, you will receive specialized training on their proper use. OSHA requires this training, which includes safety information you need to know. All facilities must also make available a Material Safety Data Sheet, MSDS, for every chemical used on the premises. Each sheet lists the product's chemical contents, fire and health hazards, use precautions, cleanup procedures, disposal requirements, necessary personal protective equipment, and procedures. These sheets are kept in an accessible location, such as the nurse's station. If you are exposed to a chemical and have a reaction, go to the emergency room of the nearest hospital and take the MSDS with you. Employees' rights to know. As an employee, you have a legal right to see certain kinds of personnel and safety records. In addition to your employment and medical histories and job description, you have the right to see documents affecting safety in the facility. You can request to see your department's chemical inventory list, material safety data sheets, and the OSHA publication, Access to Employee Exposure and Medical Record Standard. You may want to read these if you have questions about which chemicals you may be exposed to on the job or what to do in an emergency. Safety around oxygen. Oxygen, O2, is an important gas in your facility. Oxygen itself is not flammable, but it can make other things ignite and burn. Its use increases the risk of fire and explosion. Because of these risks, you must follow certain precautions in areas where oxygen is being used. Oxygen can come from several different sources. It may come from a valve in the wall, from tanks of compressed gas, or from a machine called an oxygen concentrator. Regardless of the source, these precautions always apply. Keep all flames and potential sources of sparks away from oxygen. There must be no smoking when oxygen is in use. Place a no smoking, oxygen in use sign on any door to a room where oxygen is being used. Never put any kind of lubricant on hoses or fittings used with oxygen because this could start a fire. If the pieces don't go together smoothly, tell the charge nurse. Never try to force a fit. The tank may be labeled incorrectly. Disaster preparedness. Disasters include natural events such as tornadoes, hurricanes, tropical storms, floods, and earthquakes. Explosions, fire, and acts of violence that disrupt the normal functioning of a facility are also considered disasters. All facilities have written disaster plans in case of an emergency. These plans usually say that employees must first move residents to safety and then care for them. Regardless of problems caused by the disaster, you must still meet the needs of your residents. Disaster plans do not assign tasks to people by name because different staff members are on duty at various times. Emergency tasks are assigned by job title or job description. You must be familiar with your facility's disaster plan and know the role of nurse assistants in the event of a disaster. Weather-related disaster. Possible weather events depend on the region in which you are located. Emergencies can occur suddenly, as with a violent storm, or with advanced warning, such as with a hurricane. The charge nurse will tell you when to evacuate residents following either the internal evacuation or external evacuation plan. Every facility has an evacuation plan that contains a priority of movement. This is the order in which residents should be moved. As a nurse assistant, you need to be aware of the policy and confident of your role in the evacuation. During an evacuation, a senior nurse or administrative staff member will be giving instructions. It is important for the safety of everyone that you stay alert and follow directions. To evacuate bedridden residents, you use emergency transfer methods that are quick, efficient, and safe. These methods are different from your usual transfer techniques. Fire. Fire safety and preparedness are a major responsibility for all employees. Your role in emergency preparedness is important. Stay on the alert for potential problems and participate in all prevention activities to help keep everyone safe. In your new employee orientation, you will learn your facility's fire plan. Fire procedures are posted in each department and at each nurse's station near the phone. In areas that do not have 911 response systems, local emergency phone numbers should be posted for the fire department, police or sheriff, ambulance, and poison control center. Fire drills should be held at least every 3 months on each shift. You must participate in these drills to ensure that you and all staff are prepared as possible. To prevent fires, follow these guidelines. Report any unsafe conditions so that corrective measures can be taken right away. Enforce no smoking regulations. In smoking areas, safety ashtrays should be used, and cigarettes must always be out when discarded. Never store anything within 18 inches of a water sprinkler head. Do not park linen hampers or food carts where they will block or hide a wall-mounted fire alarm pull station. Keep corridors and exits free of equipment that cannot be wheeled out of the way. Exit doors and fire doors should never be locked or blocked. Doors to maintenance areas, elevators, equipment rooms, and boiler rooms should always be kept closed. First to notice a fire. If you enter a room where there is a fire or you are the first person to see a fire, do this. 1. Stop and quickly assess the situation. 2. Yell for help and sound an alarm if one is present. 3. Immediately remove all residents from the area. Do this quickly because smoke inhalation causes most deaths and fires, not the fire itself. If possible, turn off residents' oxygen. 4. Do not open the windows. 5. When everyone is out, close the door to the room. Most doors in healthcare facilities are fire doors. They help contain a fire for 1 to 2 hours. 6. Evacuate the residents from rooms on both sides of the room that is on fire. 7. Never open a closed door during a fire unless you have no other choice. If you must open, place your hand on it first to check if it is warm, and look for smoke coming from underneath. If the door is warm or you see smoke, do not open the door. Opening the door allows oxygen into the room, strengthening the fire and risking an explosion or serious injury. 8. Move residents at immediate risk to the end of the wing furthest from the fire, or remove them from the wing or unit entirely if instructed to do so. 9. Use a fire extinguisher only if the fire is very small and contained, such as in a wastebasket. Do not try to fight a larger fire because it can get out of control quickly. Fire alarm on another wing or unit. And follow your facility's emergency plan and the charge nurse's instructions. 2. Clear residents out of hallways into their rooms and close the doors. Remember that these are fire doors. 3. If several residents are in a gathering area, close the door to that room instead of moving them through fire door. Return them to their rooms. Act calmly and reassure the residents. 4. Make sure the halls are free from obstructions. Evacuation. Evacuate residents per facility policy. The reason for having a priority order is that if evacuation began with bedridden residents who take more time to be moved, the process would take longer and more residents could potentially be trapped in the burning area. Moving ambulatory residents first means that more residents will be saved if the fire spreads quickly. Priority order for evacuation. 1. Those nearest the fire first. 2. Ambulatory residents. 3. Ambulatory residents who need assistance. 4. Residents who use wheelchairs. 5. Residents who are bedridden. 6. Residents' charts and medication carts. The nurse assistant role in emergency care. As a nurse assistant, you must be prepared for emergencies and know how to respond. Being prepared helps to prevent or at least control the chaos that often surrounds emergencies. When your facility holds emergency drills, treat the practice situation as you would a real emergency. When you are completely prepared and know what to do, the steps to take will be natural to you during an actual crisis. Know your facility's policies and procedures and where emergency equipment is located on the floor or unit where you work. A resident's condition may suddenly worsen, or a resident may be injured unexpectedly or develop a life-threatening condition. Situations are medical emergencies. The first aid given to a resident in a medical emergency before a physician or emergency medical professionals arrive can prevent serious problems and even save their life. The goal of this initial treatment is to save the resident's life, prevent disability, and prevent an injury or sudden illness from getting worse. First aid is administered by a nurse assistant only until healthcare personnel with more training arrive and provide additional care. What to do? When an emergency situation arises with a resident, you must remain calm, stay with the person, call for help, and begin first aid. When help arrives, you are expected as needed. When you first realize an emergency is happening, ask yourself these questions. What exactly is the emergency? Do I know what to do? What should I do first? The following are general guidelines for action in an emergency situation. If possible, use standard precautions and put on gloves. Remain calm and let the resident know that you are there to help them. Do not move the resident unless you must remove them from a dangerous situation. Moving a resident if you are not properly trained could cause further injury. Know the codes your facility uses to identify emergencies. When a code is called, all staff must know what is happening so that valuable time is not lost. Keep an injured or suddenly ill resident warm by covering them with a blanket. If it is very hot, lightly cover them with a sheet. After the charge nurse arrives, you may be asked to call 911 or your local emergency number. When you speak with an emergency operator, provide this information: name, address, and telephone number of the facility, the nature of the emergency, and what type of first aid has been given. Heart attack. The heart is a muscular, hollow organ with 4 chambers. The heart pumps blood containing oxygen and nutrients to the entire body. The heart muscle itself needs a blood supply, and the coronary arteries supply it with oxygenated blood. When this blood supply is interrupted due to a blockage, a heart attack occurs. The clinical term for a heart attack is myocardial infarction, MI. Blockage can occur due to plaque or protein, along with cholesterol in the lining of the arteries breaking off and forming a clot. This clot then blocks the flow of blood. If a resident tells you that he or she is having chest pain, this is very serious. You must report it immediately. Chest pain is always considered a sign of a heart attack until the responding medical team determines the exact cause. The charge nurse may ask you to monitor the resident's pulse and blood pressure during the episode. You should immediately report any change in the resident's vital signs. Many people having a heart attack do not experience chest pain, and women often experience symptoms that are different from those of men. Other signs and symptoms include dizziness, lightheadedness, nausea or abdominal pain, anxiety, shortness of breath, pain in the head, neck, or upper body, a sense of tightness or fullness in the chest, pain in one or both arms, weakness, pale color in a light-skinned person or an ashen skin tone in a dark-skinned person, cold, calmy sweat, palpitations, rapid or irregular heartbeat. Residents may downplay their symptoms because they do not want to believe that something serious is wrong. If a resident shows any of these signs and symptoms, report them to the charge nurse immediately. Early treatment improves the chance of survival and can minimize damage to the heart muscle. Once you have notified the charge nurse, take the resident's vital signs and help them to a comfortable position. Loosen tight clothes. Stay with them. Often the resident is frightened, so stay calm and reassure them that help is on the way. Cardiac arrest. Cardiac arrest is the sudden loss of heart function, no heartbeat. Cardiac arrest may result from various causes, including a heart attack. These signs include no pulse, lack of normal breathing, pale grayish skin color, and blue lips, loss of consciousness. The treatment for cardiac arrest is cardiopulmonary resuscitation, CPR. Each facility has its own protocol for treating a resident who is experiencing cardiac arrest. Know the procedure where you work. Not all residents want to receive CPR. Some residents have signed a living will or advanced medical directive stating that they do not wish to be resuscitated if their heart stops. If you find a resident who is not breathing and has no pulse, call for help immediately. Every second counts. The charge nurse will know residents should receive CPR and those who should not. While all staff should be aware of the Do Not Resuscitate directives, the charge nurse can confirm the resident's status. Depending on your facility's policy, you may need to learn how to assist with CPR. To administer CPR, you need special training and certification. If your facility does not offer CPR training, you can take a CPR course from the local American Red Cross, American Heart Association, or community hospital. Choking. Many people die each year by choking. Choking usually happens when food or another object gets stuck in the throat. Residents are at risk of choking. Their bites of food are too large or are poorly chewed. They talk or laugh too much while eating. Their dentures do not fit well. They have a chronic illness or stroke which causes weakness and difficulty swallowing. If the throat is completely blocked, this is called an airway obstruction. You must act quickly. You only have 4 to 8 minutes to save a resident's life. A choking victim who is still conscious will usually grab or gesture at their throat. In some cases, the resident may already be unconscious when you find them. Signs of a complete airway obstruction include bluish skin, lips, and nails, difficult noisy breathing or not breathing at all, inability to speak or cough with force. With a partial airway obstruction, the resident can speak, breathe, and cough, but may have difficulty breathing and may not be getting enough oxygen. If the resident cannot eject the object from their throat by forceful coughing, assistance is likely needed from an emergency medical team. The charge nurse may ask you to call 911. It is important that you are familiar with the emergency equipment used in your facility because you may also be asked to get items such as oxygen and suction equipment. When a resident is choking, you should 1. Ask, "Are you choking?" The resident will not be able to answer if his or her airway is completely blocked. 2. Call for help. 3. Never leave the resident. This is a life-threatening situation. 4. Administer first aid for choking. When performed properly, the Heimlich maneuver will dislodge the object from the resident's throat. Seizure. A seizure can be caused by many different conditions, including a brain tumor, infection in the brain or spinal cord, head injury, medications, poisoning, or a seizure disorder such as epilepsy. Often residents with a seizure disorder are on medication. A seizure is abnormal electrical activity in the brain that produces sensory and behavioral changes and changes in consciousness. Seizures may be classified as simple or complex. With a simple seizure, there is usually no loss of consciousness. A complex seizure usually involves a change in the level of consciousness. Seizures are also classified as generalized and partial seizures. The type of seizure depends on how much of the brain and body is affected. With generalized seizures, the entire brain is affected and the resident may experience massive muscle spasms, fall to the floor, involuntarily urinate or defecate, and/or lose consciousness. To help a resident having a generalized seizure, you must remain calm and call for help immediately. Do not leave the resident alone and reassure the resident that you are there to protect them. First aid measures are described in Procedure 5-5. In a partial seizure, the abnormal activity happens in only part of the brain. In this case, symptoms are specific to the part of the brain affected, and only one side or part of the body is involved. A resident having a partial seizure may have a dazed, blank look and experience jerky movements on one part or side of the body. Sensory changes may also occur, such as a prickling sensation or numbness. First aid may not be needed for this type of seizure, but you should remain with the resident and observe, report, and record what you see during the seizure. Minutes or hours before a seizure, a resident may experience an aura. Often the aura involves one or more seizure. A seizure can be caused by many different conditions, including a brain tumor, infection in the brain or spinal cord, head injury, medications, poisoning, or a seizure disorder such as epilepsy. Often residents with a seizure disorder are on medication. A seizure is abnormal electrical activity in the brain that produces sensory and behavioral changes and changes in consciousness. Seizures may be classified as simple or complex. With a simple seizure, there is usually no loss of consciousness. A complex seizure usually involves a change in the level of consciousness. Seizures are also classified as generalized and partial seizures. The type of seizure depends on how much of the brain and body is affected. With generalized seizures, the entire brain is affected, and the resident may experience massive muscle spasms, fall to the floor, involuntarily urinate or defecate, and/or lose consciousness. To help a resident having a generalized seizure, you must remain calm and call for help immediately. Do not leave the resident alone and reassure the resident that you are there to protect them. First aid measures are described in Procedure 5-5. In a partial seizure, the abnormal activity happens in only part of the brain. In this case, symptoms are specific to the part of the brain affected, and only one side or part of the body is involved. A resident having a partial seizure may have a dazed, blank look and experience jerky movements on one part or side of the body. Sensory changes may also occur, such as a prickling sensation or numbness. First aid may not be needed for this type of seizure, but you should remain with the resident and observe, report, and record what you see during the seizure. Minutes or hours before a seizure, a resident may experience an aura. Often the aura involves one or more points to remember. Protecting residents, staff, and yourself from bloodborne pathogens is an important part of your job. You must exercise care in the handling of sharps and follow facility procedures for all care activities to prevent the spread of infection. Injury prevention involves using proper body mechanics when lifting and moving objects in residence and in all daily care tasks. You can prevent resident falls through careful monitoring and the use of assistive devices when needed. Being aware of chemical, electrical, and other environmental hazards is part of your role in preventing injury to yourself and others. Disaster preparedness includes knowing the facility's disaster plan and what your responsibilities are in keeping residents safe. The nurse assistant has a specific role in an emergency. You must understand emergency procedures and first aid guidelines and know how to assist if a resident experiences situations such as choking, falling, bleeding, burns, seizure, or heart attack.